and I appreciate that. That, again, is important for you to do, and CDC has recommended it for a couple reasons. First of all, assuming that you may be a COVID carrier or COVID-19 carrier and you're asymptomatic, that is going to help prevent the spread from you to other people. It also does provide some protection for you as an individual, but primarily that mask is used to prevent any unknown COVID cases from spreading throughout the community. So please wear your masks. Healthcare providers also wear gloves to protect themselves and their patients. Most others wear gloves to protect themselves. You should continue to do everything you can to protect yourself, whether or not others are wearing masks or gloves. Each of us needs to protect ourselves and others in addition to what others are doing. So if you do have questions about people wearing gloves, those are gloves that they are utilizing to protect themselves from contamination. It is not necessarily going to protect you from contamination because they are wearing gloves. So again, it's your responsibility to protect your own health, and you wear protective gear in order to do that. I have with me today Randy Schwann from Trinity Health and Dr. Sather from Trinity Health. Tammy Ness has joined us from North Central Health and Human Services, John Feldall from Ward County, and Mayor Sitma from the City of Minot. We are going to keep our comments brief and to the point, but hopefully provide good information to you. The governor is now speaking at 3:30 every day, so we will try very hard in respect for him to be done with this press conference by then. I know that in the future we will be realigning these, or just stay tuned, and we will be giving new times for these press conferences so that we don't conflict with his press conferences. So with that, I will ask Randy Schwann and Dr. Sather to come forward.
Thank you, Lisa. Good afternoon, folks. I'm Randy Schwann from Trinity Health, and with me is our Chief of Medical Staff, Dr. Jeff Sather. I think my comments today are aimed at giving you an idea of what we're doing at Trinity Health, as well as some reminders, and then addressing some of the questions that might have been posed to me in the past few days. First of all, I wanted to give you an update as to the number of total patients we've had at Trinity Health that have been positive inpatients for COVID-19. We've had a total of 8 patients hospitalized. 2 remain in the hospital. 5 have been discharged and are at home. Our system provides for folks calling those discharged patients to see how they're doing and to help them in their recovery. We're working with other agencies in this region now to help fill the gap of the kinds of services that somebody might be needing at home who shouldn't be out shopping and who can't go out shopping. So I know that there are good people out there that are willing to help, and I think that we're going to be announcing some ways that can happen for these people and other people who are quarantined at home and really shouldn't be out in public. So I know that those exist, and we'll probably hear more about that later. I wanted to report on the outstanding response we've had in the community over providing some of our non-clinical staff with cloth masks, those home-sewn masks that was sported about as you came into this room. And Lisa was talking about her mother made hers, and I know lots of people are busy at home sewing them. We've had a great response and have collected around 700 or so for Trinity Health employees, and they're using them today in the non-clinical areas. They're not allowed to wear them in the clinical areas because we save that for the more medical approved surgical masks for those staff. So I just wanted you to know what's happening to them. We do appreciate your help and are asking for more. I think our goal was around 1,500 or so we thought we'd need, so thank you for your help. And I know that there'll be more people needing them now that they've been a CDC guidance for most of us to wear, so calling all sewing warriors at home to continue doing that. At the same time, we've also put out a call for help with 3D printed masks, which is more of a surgical mask alternative. A little step better than the cloth mask for sure. And we are allowing those 3D masks to be worn in clinical areas in place of a surgical mask so that we can preserve and conserve the amount of medical surgical masks that we do have. We know we're going to need them for the clinical staff as we go forward in this event. So the specs for those masks are online on the web. There's a Facebook group that has been started specifically for that purpose to speak to the printing community who do 3D printing, and they've been an awesome group. It's amazing how coordinated and how cooperative that whole team is. It's made up of a lot of different groups and individuals who do this as a hobby, and organizations that have 3D printing available. And we're starting to see the fruits of that labor, so that's awesome. I want to talk a little bit about today, the question came up about COVID patients versus non-COVID patients. I talked about we do have some patients in the hospital. We also have non-COVID positive patients in the hospital, as you might expect, and that goes on like that all day, all year, for many years, right? That's how hospitals work. They have infection, they have bacteria, they have viruses, they have patients that don't have any of the above, and they all work together and are housed together in a hospital. That's how hospitals work. So the question was, well, how do you keep the two apart, right? How do you not cross-contaminate? So I thought I should address that with some brief notes. So the positive or suspected positive patients that we have with COVID-19 virus are typically set up in a situation where they're isolated from the rest of the patient population. They have a dedicated team who care for them. Typically, our effort is to have the nurse and whoever's on that team with that patient not come in and out of the room. Sometimes they're calling their nurse or techs colleagues out in the hallway. They can see them. They're right there, but they call them so that they don't have to go out and get their supply. They have it brought to them at the door. So the idea is fewer ins and outs of the room as possible. That's how we approach that. And that's following the CDC and Health Department guidelines. In those dedicated units, the team there performs most of the duties that they can. Some cases, we have to bring other people in to perform life-saving measures or specialized procedures and so on. And those folks, we don't have like a COVID radiology department and a COVID laboratory. So we obviously use systems to support all patients. If the need is for a patient like a COVID positive patient to be taken to radiology, for example, they are draped and masked appropriately. The team is also donned with appropriate gear, and they move to that region. And that happens in every hospital in the country. Just wanted you to know how that works here. For those times when you do have to move people from out of the area into one of those rooms and out again based on their specialty, our teams are skilled, they train, they're educated on infection control. They practice excellent disinfection for themselves, for the equipment. They scrub in, they scrub out, they foam in, they foam out. Those are the terms that I've heard referred to, but it means they're washing their hands hundreds of times a day and paying attention to their PPE, that they don and doff it appropriately, and they're trained in doing that. And this has been going on for decades. This is not something that's new with coronavirus, and it won't stop with coronavirus when we defeat that. I wanted to talk about a case today that kind of illustrates kind of what we did a couple weeks ago when we had staff that were exposed to a patient that became symptomatic while they were in the hospital, resulted in 49 of them or so who were quarantined in their homes. All of those folks who were tested out of that group came back with negative results. Most of that whole group is coming back to work under the return to work criteria that has been established by the CDC and the Health Department. So as we suspected, their risk was low. We said it was low. Turns out that that is accurate. Today we learned of a hospital staffer that became COVID positive following the shift of work that they worked last week. And while at home over the weekend, they experienced some symptoms. They called, they were tested, they were positive. So the same logic applies to that scenario as I did 2 weeks ago. We went back 48 hours in their work week, started looking at the contacts that they had made with patients and staff, and are working that out with the Department of Health. We will be contacting a couple of patients who were inpatients on that unit. We have not had to quarantine any staff as a result of that, based on the risk that was assessed. And I wanted to explain how that works. Like, there's 10 of us in the room. Chances are 3 or 4 of us might be carriers of the coronavirus. You know, that's just the way it works. We're asymptomatic because you wouldn't be here if you had symptoms. I trust that. But you may not know that you have it because you don't have symptoms. And in a couple days, Lisa will call us and say, hey, that last press conference you were at, I was positive. Or this reporter was positive. So we get a call from the State Health Department, and they'd say, you were in the room. What kind of contact did you have with this person? Was it close? Was it prolonged? I think it's within 6 feet for 15 minutes, I think, is the risk profile. If the answer is no, you'll be asked to monitor for symptoms. That's how that works. And just know that the people that you're around at the grocery store and the gas station and walking in the park and doing all sorts of things, social distancing aside, the people that you encounter may be in that same group. You might be in that same group. You're not immune. We are not immune. Healthcare workers are not immune. They're just as likely to catch it as you are, maybe a little less so because that's what they deal with every day, but they are in the community and they are living with family and they have friends and they have to go to work. So just want you to know, in fact, I've got some information about that. We do know that in North Dakota, there are at least 37 COVID-positive healthcare workers today. And that they have been 458 exposures, right? We told you about our 49, and we've told you about some healthcare workers who are positive. We've had 5 such workers out of that 37, and we've had less than 50 of those 458. So it's happening all around us. It's happening in every community. It's happening in every hospital. So it's just happening in every school, and it's happening in every grocery store, and perhaps radio or TV studio. So just know that it's around, and nobody's immune, including healthcare. When we see it at Trinity Health, we are acting swiftly and thoroughly to ensure that patient and staff safety is priority. And that's why I tell you this today, and that's why we told you this 2 weeks ago. I'll stand by, and maybe Dr. Sather wants to weigh in on anything, or we'll take questions.
Take 1 minute just to maybe add the lesson of the day to Randy's comments as a healthcare professional. And to protect yourself, I think just a reminder of the basic things. Now we're talking about using masks in public, and so I want to take less than 1 minute to demonstrate how to properly put on and take off a mask and talk about the important things. So the most important thing is washing your hands. So before I get my mask and put it on, the first thing I'm going to do is wash my hands. I don't have that available here, but I would do that with either hand sanitizer or soap and water, actually, is probably the best. Then I'm going to get out my mask, whether it's my nice new hand sewn one that someone gave me, or I have actually a surgical mask that we use in the medical setting. And I'm going to take my mask and I'm going to put it on. And so I'm going to do that. And I'm going to fit it the way I should. And now once I have my mask on, I'm going off to do my job. As a healthcare worker, we're requiring all of our healthcare workers to wear this all day long with the interface with patients. So I'm putting this on and I'm not taking it off. I'm doing my job, I'm washing my hands frequently, I am not touching my mask. Remember, this mask is to do 2 things. It's to protect you from droplets or aerosolization in the air. And if you're a asymptomatic carrier, it's preventing me from coughing or talking and aerosolization coming out that could infect somebody else. So this is a filter just like you have in your furnace. When I go to take it off, remember it's a dirty filter. Don't touch it. The most important thing is how you don't touch this mask once you get it on and what you do with it afterwards. I've seen people in the grocery store wearing it around their neck, wearing them on their forehead. pulling them away from their face to talk. They're grabbing the mask. So if you just touch something and your finger's contaminated, think about grabbing your mask. Now it's in your mask and against your face. So when I take this mask off at the end of the day or at my time when I need to change it because it's getting moist or whatever it is, the first thing I do is wash my hands. So I have clean hands again. Then I simply take the mask by the straps and I do not touch the mask. And now I can set it aside, and you can reuse these, you can launder them, but the important thing is this is now contaminated. It's contaminated on the outside from the guy in the grocery store I walked by that had a little cough that I wasn't aware of. It's contaminated by myself on the inside if I'm a silent carrier of this virus. And I want to protect myself and my family. Don't be touching the mask. Don't be wearing it around your neck. Don't be putting it on your forehead. Wear them appropriately. And there's information online. You can read about the proper use, proper laundering and cleaning of the sewn masks. These are for our protection. Use them appropriately, just like your seatbelts in your car. They do no good if you're not using it the way you should. So I'll be around for questions.
Good afternoon. I'm Tammy Ness, Clinical Director at North Central Human Service Center in Minot. Our agency is a part of the North Dakota Department of Human Services, and we serve a 7-county region in our area that includes Bottineau, Burke, Montreal, McHenry, Pierce, Renville, and Ward counties. We also have the capability of serving other parts of the state through telehealth options. Monitoring our emotional health is critical at a time of a public health crisis. Individuals and families are struggling with financial worries, homeschooling children, working from home, or continuing to work as an essential employee. It has created changes in how we purchase products, how we manage our meals, how we sterilize our spaces, and a great demonstration from Dr. Sather. So we encourage you to monitor yourself and those who are around you for indications of stress that could be leading to problems with behavioral health. Typical signs of stress may include irritability, moodiness, sleep problems, anxiety, excessive worry, negative thinking, or trouble concentrating. Any of these symptoms can lead to a behavioral health crisis. At this time, North Central, with the support of Trinity Hospital, would like to encourage anyone with a behavioral health crisis to contact North Central Human Services, where we would be able to provide behavioral health emergency service care as an alternative to presenting to the emergency room. This will allow the hospital to focus on emergency medical care. North Central Human Service Center is available 24 hours a day, 7 days a week, with after-hours awake staff. These staff are available both day and night for crisis calls, emergency services, screening, and referral by calling our main phone number and asking for triage or emergency services. That telephone number is 701-857-8500. During the COVID-19 pandemic, behavioral health clinics have been authorized by both the federal and state government to provide services through telehealth devices, including smartphones and computers, using telehealth conferencing platforms that are easy to connect people to. Authorization has been given for many services to be provided through the telephone if individuals do not have devices. Citizens in our rural areas do not need to drive to Minot to access behavioral health emergency services. You can call our phone number and we will work to connect you to us. North Central continues to provide on-site services for anyone who prefers to be seen face-to-face. We are following the CDC screening guidelines of taking temperatures, asking if there's been exposure to COVID-19 or if there's been recent travel to hotspots in the United States. We encourage anyone coming to the agency to wear a mask. Our agency cleans waiting rooms and patient care areas multiple times per day. Some services can be provided completely through telehealth options. If you prefer to call first, you're welcome to do that and encouraged to do that. We can oftentimes manage some of these situations by telephone, but you are also welcome to present in person. When calling or coming to North Central, you will speak with our triage team to determine how we can assist you. We can help with stabilization of crisis situations and outreach into the community, or to assist with a behavioral health crisis for you or your family members. We have the capability of responding to both adult and youth situations. If you are not in crisis, but you are seeking counseling services, the triage team can help you in locating services appropriate to your needs, either with our clinic or with another agency in the community. Please refer to the North Dakota Department of Behavioral Health website and parentslead.org for additional information about signs and symptoms and guidance about management of any behavioral health concerns during the pandemic. At a time when the COVID-19 pandemic is weighing heavily on people's lives, we encourage you to be equally mindful of everyone's emotional health as well. Thank you. John Fildell is next.
Thank you. Good afternoon. I'd just like to give you a little update on what we did at our county commission meeting today. Today was the first day we broadcast our meeting via the county website and other sources. So if people want to watch, we didn't allow public into our meetings. That'll be going forward in that manner. We made some changes in our departments as far as allowing more work away from the office space, and we have some doing that currently, and more will be to keep our staff in a better rotation so that not all employees are in buildings at the same time. We also are keeping all of our offices open. We just ask that you call ahead if you have for an appointment to make sure they can make arrangements for you. The county is, for the most part, still completely operating as normal as possible. One of the things we voted on today that'll be interesting with, our county will be totally vote by mail this year. We haven't picked the sites, but we plan on having about 7 or 8 locations throughout the county where you can drop your ballots in, and those will be noticed around the 21st of April. We'll make that decision. You will receive applications from the Secretary of State for those ballots, and they will come within probably the next couple weeks, and then they will give you instructions on how to get your ballots. A letter with the applications will come with your application for the ballot, as well as with the ballot when you receive it. We're entering into a time that we thought we should make the public aware of too. Agriculture is considered a necessary industry and business, and it's going to start ramping up here, as we all know, and we're going to get pretty busy if the weather allows that to happen. I visited with some agronomy companies, supply companies, and they've adopted policies to try and keep their staff safe, as well as the agriculture users of their services. Many companies have had these safety measures in place, and they too are only going to allow access into their facilities with a request. Couple items that come out of the Department of Agriculture yesterday. Ag Commissioner Doug Goring released a couple press releases that deal with non-essential ag activities and events, and they suggest they should be canceled. And his explanation is, we understand there's some confusion regarding our prior guidance on ag activities and events that are non-essential. Events such as livestock auction markets, ag auction sales are considered essential and can operate with certain precautions to mitigate the risks. Events such as youth livestock sales, animal shows, and other activities should either be canceled or moved to a date in the future and reassessed at that time. Also, you're going to see beekeepers starting to set out their hives in the country, and they want people to understand it takes, you're going to probably see 2 people together in the same vehicles, and that is still considered an essential service, so don't be alarmed if you see that. but we ask those producers, or he requests those producers, to operate in a safe manner. These beekeepers are returning from other states, and they have been asked to isolate from the public and understand that they will have to care for and manage their bees. In the event someone is ill, we ask the beekeepers respond accordingly to the laws that we've all adopted and abide by. We just ask that everybody in the ag industry stay safe, be careful, and respect the governor's wishes on how we treat this event. Thank you.
Good afternoon, Mayor Sean Sitma from Minot here. I don't have a tremendous amount to talk about today, but I did want to address a couple of things. First, the growing concern from the community by some calling for more strict executive action within the community of Minot. And many, of course, today even referencing what executive action in some regards was taken in Fargo and West Fargo, and that being an official announcement, I guess, or signed guidelines that strongly suggest that the folks in Fargo and West Fargo adhere to the guidelines and guidance from the CDC and the North Dakota Department of Health and other health officials. That, in fact, is not mandated for any stricter guidelines from what we are currently doing within not only the city of Minot, but Ward County and the 8-county region that First District Health has under its operations. So just for people to understand, they're sending out the message to folks, as we have been, that people need to take this serious and to adhere to the suggestions of the CDC, the North Dakota Department of Health, and the health officials, that if we take this serious, that we can knock this down without having to go to a complete lockdown of the community with essential business only and shelter in place. That is the main point that I think was being stressed in Fargo and West Fargo today. As I've mentioned before, I and the rest of the City Council and many others in the community are following the guidelines of the North Dakota Department of Health, First District Health Unit, the Ward County Emergency Management Agency, for guidance as far as next actions, if actions need to be taken. And we will continue to rely on our resources and the expertise that they have for that guidance. As the weather has been warming, we did have a reprieve because of some snow. We saw a lot of activity here about a week and a half ago. Now the weather is starting to warm again. I want to stress that people, again, take this serious, that if you do go outside, that you stay within the group, your family unit, those who are you're interacting with, because every outside connection represents either another opportunity for infection or to spread infection. This includes the parks and other outdoor areas, including the dog park. And things like pickup basketball games or going even onto the playground represents a high-risk situation. It is going to be up to the individual responsibility of everyone in this community. If we can get through this without a complete lockdown or shutdown, that is only going to be better for the community if we can get through this by everyone taking the individual responsibility on this. We also have the Easter weekend coming up. And it is very difficult for a lot of people to imagine not filling up a household on this holiday that is approaching, but that would be against every other guideline that has been put out there by the CDC. You can reach out electronically. You can gather around an iPhone and help spread that message and spread that cheer to your family members. But again, coming together into a large group, again, just represents an even bigger risk. I think what we're looking at here is, again, the message from the CDC. It's been said over and over again. It is stay safe, stay home at all times possible. And if you do go out for shopping, these are going to be for your necessities, not because you're bored at home. Most people have been doing a fantastic job on this. Some have not. And anybody who has gone out can quickly recognize the people that are gathering in the aisles who are not wearing masks, who are not taking this serious. This is going to have greater economic and psychological impacts well into the future if we don't take this serious now. We take it serious now, we can put an end to it and get back to what we hope is normalcy very quickly. Outside of that, we are going to continue to monitor the activity in and around Minot with our partners, all of our partners, to continue to weigh that option if any stronger stance is necessary. But again, we will follow the guidelines of the North Dakota Department of Health, the governor, First District Health, and our health professionals. Thank you.
Okay, we are going to take a couple questions from each of the media outlets. So, who would like to go first? Jean?
Question for Randy. Oh, issue on the numbers, I might have heard you wrong. 8 total treated, 2 still in hospital, 5 recovering, there's 1 missing from there.
Yeah. Not recovering.
Okay, gotcha. Understood, all right. The other question would be for the 3D printing.
Yeah.
The library has a 3D printer. Is that something that the city of Minot could, I don't know anything about that stuff, but could the city of Minot or the library help out with that?
So we've been hearing from a lot of groups, both organizations, public organizations, private individuals, hobby groups. I don't have a list of all of those who are signed on and working, coordinating that together. They're sharing ideas, they're sharing print settings, they're doing a great job of kind of coming together as one mega group. Don't know if the library is part of that. They are, so we appreciate that. So like I said, I don't know the list, but it's getting longer all the time. We've had calls from out of state. Actually, we've asked them to call their local hospital to see if they need their assistance more. We're not trying to get masks sent to us from all over the country. We think we have enough folks around here that can help our local healthcare system. And if they're interested in doing that from where they are at, if they're not in our region, we ask them to contact their local hospital. We'll try to help them set up a program similar to what we have with either the sewn mask donation or the 3D mask and shields. We're asking for the shields as well, and that's been moving along nicely.
Randy, question for you. For the new staffer that was positive, do you know if they possibly had any effect on patients, and are there any further quarantines between the initial 40, this person?
Good question. So the initial 40 we talked about, they're coming back to work. They're all done. The new staffer that became symptomatic at home was traced backwards in time, a couple days, to when they were on the floor working. And we've contacted patients that they had close contact with. And there were 2. And there were no staff that were involved in that same level of a risk assessment that was conducted by both us and the Department of Health. So I think that answered your question.
Yeah, and also you started to talk more about the discharge rates that you guys have had. Have you been able to make any kind of conclusions with how well the treatment's going based on having however many discharges?
So we talked about 5 successfully discharged home. They're doing well. That success speaks for itself. I think the reason I wanted to mention that is to let you know this is not a death sentence. I think we hear more about that part of it than people who encounter some minor symptoms or even bad symptoms but resolve on their own at home. In these cases, they were brought to the hospital in a more emergent situation, and they've gone home. So some were in ICU with ventilators, some were not. But the bottom line to that message is stay home until you need urgent care, emergency care. If you need to come to the hospital, come to the hospital. If that's what you need, we will treat you, and hopefully you go back home. So
Do you have a number of patients that had to use ventilators?
I don't have that.
Are you guys still okay with ventilators?
We are okay with it.
Patients who
Yeah.
need them?
The question about ventilators, we have adequate number of supply of ventilators now. We know that our state capacity is somewhere around 451 or so. I believe the governor has it in his report. So if we need more, we can get more from other locales that don't have that use right now. And I think you're seeing that same level of coordination across the country, at least calls for that. And I think that we're other interested parties like public health. So we conduct that call twice a week to just share what is going on and how we can help each other. We're a team, and that's how we'll get through this.
But right now, you're not in need of any extras. You have extras.
Right now, we have extras. Yep. Go ahead.
She has a question.
So the topic of telehealth did come up during.
Yeah.
Is Trinity Health currently or working on offering telehealth services for those who may not need to come to the hospital but still want to be seen?
Great question. So as far as Trinity Health and its telehealth efforts, we are expanding our capacity in telehealth. We have a number of community or clinics that are doing it already, have had done so successfully over the last couple of weeks. We're rolling that out to more and more clinics in more and more locations outside of Minot. So that is progressing nicely. Patients appreciate not having to come out of the house for their follow-up care. Typically, the provider will call you for an appointment that's coming up, and they've determined whether or not you're eligible for a telehealth visit based on what you're needing the appointment for. Some would be eligible and some would not. So they'll let you know that you could conduct that by telehealth if you wish, and then there's a series of downloading an app to a device at home. We'll walk you through that process. We'll send you information to help you do that successfully, and we'll hold you by the hand all the way through, literally, not virtually by the hand, and we'll get that application onto your device to allow for that visual telehealth visit. Thank you.
Did either of you have any questions? Jill?
You said 5 of the 37 healthcare providers in North Dakota were with Trinity?
No, they weren't with Trinity. We've had 5, yes, 5 with Trinity. Of the 37 that have been reported to have been positive in the state.
You talked about the one.
Yeah.
What the,
They were, again, assessed for risk, and they were quarantined at home, and they're not back to work yet, but they will be soon.
but they did test positive.
They were positive, yes. Yeah, so far, all of those cases that I'm aware of at Trinity Health, the positive test and the survey that goes on, the study that goes on after that becomes positive, you go through a series of investigations by the Department of Health and by the organization. Those have been community spread and travel. That's not a patient to staff, staff to patient, staff to staff, none of that. There's been no evidence of that happening. It's been, they were elsewhere, they returned home, they had onset of symptoms, or they can't determine where they contacted the virus. So it's a community spread issue. And if you've seen the state statistics on community spread, it's high, higher than travel, actually. So it's in your community. It's in this building somewhere, I'm sure of it. Maybe not this, hopefully not this room. But building by building, it's around you. And so just need to remember that.
Yes. Okay. One more quick.
Okay, cool.
Thank you.
Since we last spoke, any update on condition of that first police officer with COVID-19, and is the city taking any added steps to protect employees and public service?
So Mayor Sean Sitman, the question was regarding the individual that did test positive. The police officer is still recovering. The update on that is, of course, limited only because of their HIPAA laws with concerns with our own, I guess, address and specific to any one individual and their own health assessment. I will say this, that all indications that the recovery is going well, and that certainly after they've gone through the period of time in recovery, we hope that the officer, of course, is back and serving the community well. We have taken and continue to look for more ways that we can improve upon our own I guess, activities and processes and procedures, not only within the police department, the fire department, but within all different sectors of the government. And I know that that's happening across Ward County as well and many levels of government, so that telecommuting, social distancing, and continuing to get as much distance and following all of those guidelines that we're asking everyone else to do as well. We talked last press briefing about the firefighters and the police officers and a difference in how they're responding. That has not changed, but I can tell you that it is a day-to-day assessment on where we can make improvements so that we can try to keep everyone within all levels of government as healthy as they can be. Thank you.
Right. Well, I want to thank all of you here from the media, helping us spread the word and assisting in reiterating the importance of everybody's participation in responding to the COVID. Stay tuned for next week. We will announce most likely a new time so that we have more time for questions and answers. And right now, I would encourage you to quick switch over to the governor. He always has important information to share, and stay tuned. So thank you so much. Bye.